So today I'd like to share with you another batch of information which will be useful for you to understand something about sex hormones. I wanted to focus today on what people mean by bioidentical hormones, human identical hormones, yam soy derivatives, and synthetic hormones, glandulars, and homeopathic dilutions. So the most important thing that you need to understand is this study that was done in 2002 in which 16,000 women were studied to look at synthetic hormones. Synthetic Provera, which is medroxyprogesterone, and the second one is Premarin, which is from horse. So what happened was the study was an excellent study. It was stopped short because of the complications. And you could see here, just to make it simple, that there are cardiovascular problems at 29% increased risk. There's also breast cancer and cancer risk at 29%. And there are venous clots in 100%. This was a major study that was done worldwide, and people stopped using hormones. For me, this was a blessing because it gave me a chance to show what synthetic and animal hormones could do. Now, in this paper, and I urge you all to read it, many of the people who talk about it never read it. You could read it online. It's free. It says that transdermal natural estradiol and progesterone, which more closely mimics the normal physiology and metabolism of endogenous natural hormones, may provide a different risk-benefit profile. Nobody ever reads it. It's in the last part of the study. They admit it. And that's why I thought this was one of the greatest studies done to promote the use of natural hormones. So this is a caricature, and what we're doing is giving horse hormone to us, but here the horse is saying absolutely not. And you could see the weight difference. A horse usually weighs about 1,600 pounds, and you only weigh about 150 pounds at most. So in 1976, I was a resident at Harvard, and one of the most prominent cases I remember was a 29-year-old gal who came in on birth control pills, and she had shortness of breath. This is early on in the development of birth control pills, and she refused to go home even though we couldn't find anything. The next day she died. She had a massive pulmonary embolus, which we did not see. And so the only drug she was on was birth control pills. At that time, the dose was much, much higher. And therefore, I remember distinctly in my mind that I'm always watching out for this thing. So one of the most important books I've read in my life was Barbara Seaman, the greatest experiment ever performed on women. I think you should read it, because it'll make you understand about men's hormones and women's hormones and all the evolution of what we did to understand it. Now, in a female lifetime, as you've seen, the prepubertal stage, the adult stage in which you feel the best and look the best, and then the perimenopausal, menopausal stage in which the progesterone drops down dramatically and the estrogen stays around 200 and then dwindles down slowly. So there is a pronounced change in the ratio. So 2 ovaries in your lifetime, we know about this, 2 million eggs. By puberty, only 400,000. And each menstruation relieves you of 1,000 follicles. And by this age, you have very little. So this is a lot of energy, and it requires a tremendous proliferation of tissues and wasting of tissues. In men, what you see is the height of testosterone development around age 25, and then a slow but gradual dwindling. If we suddenly cut off the testosterone, you have the same symptoms as women of hot flashes. But also they start developing fatty estradiol estrogen. 2 testicles, 700 million Leydig cells. There is 250 million by age 70. The testosterone level decreases 2% per year starting age 35. And lifestyle do affect you, especially sleep. The evolution of hormones takes a long time. We know this by Baker's good research, showing that it takes about 500 million years to change one hormone. So, in a world where technology has made such advances such that we're living 3 times the span of our reproductive usefulness, it just can't catch up. So the hormones peter out. So, YAMs. YAMs is this Latin name, but this is the guy which is the most popular. It was developed in 1940, in which they found that this YAM can make, which has this molecule here, Diosgenin, which looks a little bit like estrogens, okay? It's not. And they have food. In China, we drink this kind of soup. People make powders. This is the raw yam. And in Taiwan, they even have a cream. And many parts of the world use this as an estrogen type of an analog, but it isn't. Okay? So, just to make things simple for you, the cholesterol molecule is the backbone of all sex hormones, adrenal hormone, and vitamin D hormone. Vitamin D is not a vitamin. So 1, 2, 3, 4, and then the branches here, which make a difference. So if you look at this, there's a big difference between YAM and human progesterone. You see it right here. Do you see that? 1, 2, 3, 4, and then this glob. So you cannot say that this is the same. The body knows it, okay? And soybean is another form of a precursor of natural hormones that's been developed in 1940s and 50s by Dr. Russell Marker at Penn State University, in which he showed Diogenin, and this molecule actually looks a little bit like progesterone, but it is not the same, as you could see here and here. And this is what the plant is. And it's not surprising that the biggest manufacturer of hormones and steroids and prednisone, birth control pills, is Mexico and China. Okay, so how steroids, both bioidentical, synthetic, developed. Russell Marker showed the degradation and micronization process started in 1940. At that time, he bought 10,000 tons of yam, worth about $3 million in 2009, and he made the first progesterone, which is absolutely natural. This is exactly what your body made for over 50,000 years. Okay? And bioidentical means that also. So I like to use human identical because it makes it clear that there's no substitute. Now, all the birth control revolution started with this, prednisone started with this, and what they mean by micronization is to grind it and make the molecule small to the size of 3 to 4 nanometers, and such that it's absorbed easily. The famous company Syntex has been the greatest producer of hormones, and as well as China right now, worldwide shipment to all the hospitals, to all the practitioners all over the world. They're the wholesalers. So, Dr. Catherine Dalton in England was the first one to show that the natural progesterone had a real value in changing a woman's life. So, it isn't new. She was one of the greatest physicians that I have respected and followed. And it isn't that she was alone, but there were others who came by after her. My 2 great teachers were John Leaf and David Zava. They taught me more about steroid chemistry than any chemistry I have ever learned. And it took a lot of personal experience plus the two great people to show me what natural, human identical, bioidentical hormones are and how they work. Again, if you don't go out without any further knowledge, you should know that the commonly used ones are progesterone, estradiol, which is very powerful, estriol, which is very high in women, especially at pregnancy, and testosterone. These all have that cholesterol molecule backbone. Please remember that cholesterol is not a bad guy, as it's propagandized. It is the most important molecule of your body. Okay, if you go away today, you just need to understand a couple of things. Provera MPA, medroxyprogesterone by Wyeth Company, is not the same as human identical natural hormone progesterone, as you could see right here. It's very obvious. If you could remember that, you know what you're doing, and you've learned the most from this presentation. The second thing is Premarin, which is CEE, conjugated equine estrogen, is not the same as human identical or bioidentical or natural estradiol. They have estradiol, but they also have equilin and 17-dihydroequilin, and the proportions are different. So how can you give this to somebody and say it's completely the same as natural and human identical hormone? Obviously not. If you took chemistry, you would know right away. Okay, who is the guy who actually does some bad things to you and is supposed to do good things for you? The liver. The liver always knows when you put something in your body that should not be there, but it also is what we call the policeman of the body. It actually deactivates most of your drugs and your hormones and other things by 90% on the first pass. Okay? Not natural or toxic chemicals like xenobiotics, DES, Agent Orange, all look a little bit like some of the natural hormones. That's why DES had so many problems with the women who used it for fertility. Now, the liver recognizes everything because once you take it by mouth, it goes into the small bowel and gets absorbed by the liver, and 90% of this is broken down before it reaches the target tissues. Okay? So if you remember this, it's a very important key slide in you understanding what to do. Okay, what are the women blood samples as a snapshot of a movie? You are the movie. The blood test is a snapshot that gives me an idea of what's going on with your biological hormonal age. It is not exact, and it always changes. And these are what we look at, okay? For men, these are what we look at. But one of the things that we look at men is the hemoglobin A1C, which is a potential for diabetes. Why hemoglobin A1C? Because you can't cheat. You can't come to my office and say, my blood sugar is only 70 because I secretly didn't eat last night. Okay? Because the hemoglobin A1C will tell you in 4 months what you've been eating. So we know, when I see a patient with low blood sugar and his hemoglobin A1C 7, I know he's trying to please me by having a good lab result. Okay? So these are all important, but I don't want to spend too much time on it. Testosterone is among the other androgens that are very important. Testosterone, dihydrotestosterone, DHEAS. These are very important ones, but guess what? The liver recognizes these unwelcome friends. Okay? The ones with the arrows are all acceptable. They will convert and become natural hormones, and they will act like natural hormones and be degraded by natural hormones. And guess what? The liver will also recognize it as a friendly hormone that it could break down. Why did we make synthetic hormones? The reason is because we want it to last longer. But the liver doesn't like it. So what does it do? It creates a new hormone, new protein, and new products which will fight you. That's why birth control pills leads to a protein made by the liver to give you clots. Don't forget that. Okay, a lot of times in testosterone, we could give a little, we could give even lollipops or even the pellets. You see that? And this could be implanted into you if you don't have enough. I have 90-year-old men who look like 60 years old, very active, using these implants for the last 7 years. Typically, the micronization of natural hormones and bioidentical hormones, I want to show you this because I want to show you the typical doses because we don't have time to go into detail. We use creams. For instance, the 20 milligram cream will put a woman to sleep. Okay? Asians and Caucasians are different. Asians seem to use less. Okay? The patches, we could put a patch on a person and it will stay for 3-4 days. We use drops in your mouth. We use lollipops and troches. We use rectal suppositories as we need it. We use vaginal suppositories. And these doses, for instance, the vaginal suppository works very well for women who start leaking. If they do this early, their leakage is gone. So what I say to myself is, if somebody practices the Tao and practices the vaginal contraction and practices the vaginal egg and uses some of this cream, will she stop her incontinence? Pretty sure. We see that. So there might be a synergy in the two functions. So we use pellets. For young men, we don't use testosterone. We use human chorionic gonadotropins because we want their sperm to keep producing. We give injections. And for men and women, the pellet doses are different. My most successful women have pellets, and they're known worldwide, but they will never tell you, but they function very, very well. The biggest problem that we see clinically is the sleep problems for women, okay? These are all the other ones, and the reason why we have to use the bioidentical hormones is because it's safe to use this to prevent and to alleviate some of the problems, okay? So this is typically dense breast. Many people have it, and you have your mammogram yearly. And what we notice is that we give them a small dose of 20 milligrams and rub it along the tissues of the breast. In 1 year, it's gone. So you have just alleviated one of the major problems in disease formation. Okay? So sleep and breast density is one of the most common things that we see. I recommend these books. This is the best book for women to understand. It has both intellectual and professional information as well as layman's language so you could read it and easily understand it. For men, I recommend these two.